Antihistamines, a respiratory class.
Respiratory medication alleviates symptoms of common respiratory disorders.
Antihistamines counteract allergy symptoms by blocking the effects of histamine and are used for mild respiratory allergies.
The respiratory tract helps with smell and in the warming, filtering, and humidifying of respirations.
The mechanism of action for antihistamines. Mast cells are located in various tissues with high concentration in the nose, mouth, feet, internal body surfaces, and blood vessels. The cells respond when antibodies bind to the mast cells' receptors, which signal the release of mediators like histamine.
When histamine is released, it binds to histamine receptors H1 and H2. When histamine binds to the H1 receptors on smooth muscle cells, it promotes bronchoconstriction, vasodilation, increased capillary permeability, edema, and decreased blood pressure, with increased secretions. Antihistamines focus on the H1 receptors by blocking the action of histamine binding to the receptor's site.
There are three different types of H1 blockers: central acting, or Benadryl, peripheral acting, or Allegra and Claritin, and intranasal, which is ozalastin.
The therapeutic uses for Benadryl are seasonal allergic rhinitis or hay fever, cold symptoms, allergic reactions, motion sickness, or sleep aid. Benadryl does not reduce nasal congestion.
Side effects for Benadryl are dryness of the nose, mouth, and eyes, urinary retention, constipation, and drowsiness.
The therapeutic uses for Claritin and Allegra are seasonal allergic rhinitis or hay fever.
Side effects for Claritin and Allegra are drowsiness, diarrhea, stomach pain, or headache. Side effects for ozalastin are nosebleed, headaches, or unpleasant taste in the mouth.
The most common therapeutic use is seasonal allergic rhinitis or hay fever. It is the allergic reaction to pollen. It occurs outdoors in the spring or fall. It is an inflammatory disorder of the upper airway, lower airway, and eyes. The symptoms include sneezing, runny nose, itching, or nasal congestion.
Benadryl should be administered in 1 to 2 tablets every 4 to 6 hours. Claritin and Allegra is 1 tablet once a day, and intranasal ozalastin is 1 to 2 sprays in each nostril twice a day.
Children under 6 years of age, consult with your doctor before using Claritin, Allegra, or ozalastin, and do not use Benadryl.